morning. My name is Khang. I'm the founder and CEO of Mira. And before I start, I'd love to introduce you to my friend Hannah. Hannah's in her late 20s. She just recently moved to New York City to freelance in marketing. And because she's freelancing, she doesn't have any healthcare. A few months ago, she went onto the exchange and looked for a plan herself. Because of her income, to her shock, the cheapest plan today costs more than $600 a month with an astronomical $5,000 in deductibles. So she decided to go without. While this seems sort of like a one-off situation, Hannah is part of the rising silent middle class. As we speak, 30 million people in this country have zero form of healthcare coverage. Over 52% are middle-income millennial, and in aggregate, they're spending over $36 billion per year. I know this problem very intimately because I was one of them. I came to this country many years ago and spent over 9 years being uninsured. And I became even more passionate about this problem when I became a hospital administrator. I saw how difficult it was for the hospital and the insurance company to help this population without completely disrupting themselves. So here's the pitch. You see, insurance is this sort of all-size-fits-all black box, right? Everybody in this room has the same thing. Very few of us actually understand what it does. Even fewer actually use it, right? But if we don't want to afford it or we can't afford it, there's zero other way to access the US healthcare system. And so I think to myself, and bear with me, what if we stop thinking insurance as a black box and think of it as a cake, right? And use data which we have to figure out which layer of the cake is most utilized, and then unbundle that layer outside of the cake and sell it and democratize it, make it available to everyone regardless your ability to pay. And that's exactly what we've been doing at Mira for the past year. On the way, we are also trying to do away with the very archaic healthcare experience and reintroduce Mira in a brand new experience. Mira is easy to sign up, it's cost less than a cable bill, and it's completely digital. For doctors, Mira is so much better. Instead of having to do the expensive marketing, billing, coding, and wait months for your payment, Mira functions as a gateway and allow transactions to happen seamlessly between the patient and the provider. Adoption turned out to be a little bit better than expected. In the last 18 months, we have signed up over 2,000 clinics, 1,600 labs, and 60,000 pharmacies nationally, which allow us to bring Mira to millions of more people. We currently target the top 7 markets with an aggregate opportunity of revenue near $4 billion. Compared to competitors who have raised hundreds of millions of dollars more, we're the only product that allow our user to go into a clinic thanks to our network. Mira offers a much more comprehensive way to get healthcare. Our revenue in the past year have grown over 10 times, surpassing $1 million in annual recurring revenue at a 64% profit margin, 3 times higher than the top performing insurance company with a 7 days of payback period. Thanks to our team of fabulous engineer, operators, and advisor and an angel investor, some of who are actually here, we have done all of that. We achieved the 3 most important things for an early stage startup: building a product, getting the user, and get the revenue, with only less than $3 million in capital raised from the top venture capital firm in the US. And we're currently closing a $2 million round with less than half for participation. So if you're interested in disrupting healthcare with us, you can scan the QR code here to get this deck, take a picture, or talk to me after. Thank you.